and sort of the uptick that we're continuing to see. So I'm going to ask actually to get started before we run through the slides. We have some data from the past 6 months that we want to share with you, as well as our enhanced response to some of the increased activity that we're seeing right now around COVID that we want to share. But before we do that, I wanted to ask Rita Nieves, the Executive Director of the Boston Public Health Commission, as well as Dr. Jennifer Lowe, the Medical Director of the Health Commission, to sort of just tell you briefly a little bit about what they're seeing at a high level as we sort of dig into the details. Rita, I'll ask you to share just briefly a little bit about what you're seeing.
Good morning, everybody. It's a pleasure to be here with you. Thank you for joining us, and great to have the opportunity to connect with you today and share our perspective on the current state of the pandemic here in Boston. So we're about 6 months from our peak in April, and we have seen progress containing COVID in Boston. We have experienced lower numbers during the summer months. You know, if you've been keeping an eye on the numbers, you know, we had a relatively calmer 2 months in June and July. However, as in other parts of the country, we have seen an increase in our metrics in the recent weeks. So during the last months, our residents have worked very, very hard doing their part, and so have, you know, all of our partners, you know, from city government and healthcare system, which have done an amazing job at caring for our residents and really helping us, you know, really deal with the surge. However, you know, COVID is being experienced unequally throughout our neighborhoods, and especially those neighborhoods that have large percentage of Black and other people of color and immigrant residents have experienced an unequal burden of the disease. Our Black and Latinx residents have consistently accounted for above 30% of our positive cases. And, you know, reason why, obviously from the beginning, we've centered our response on equity and have seen a reduction on Black and African-American new cases and death. And, you know, while we've seen progress within this particular group, we have seen the numbers in our Latinx community increase steadily, you know, throughout the process. Our goal, you know, is and will continue to be to focus on addressing the inequitable impact of the pandemic in our neighborhoods, and continue to use data to guide our response and our strategies going forward. As you can imagine, we have lots of lessons learned and things that we can continue to use to guide how we prepare if we do end up with a steady increase in our numbers going into the rest of the fall and the winter. So we feel like, you know, again, you know, with all the infrastructure we have in the city, our wonderful partners, both in the public and private sector, and our neighbors, our residents, you know, continue to listen to the prevention guidance and all the information we're putting out there, that together we can you know, approach, you know, what's coming in the fall and winter, and be able to control and be on top and you know, have good outcomes, you know, going forward. So thank you so much for being here today.
Okay. Dr. Lowe?
Hi, everyone. Yes, thank you for joining us today and for hearing about the progress, the efforts that we've had initiated over the last 6 months, and next steps that we have to do to keep the COVID pandemic under control. As both Rita and Marty mentioned, we have extremely strong relationships with hospitals and health centers across the city, and we've been very appreciative of the collaboration that we've had in working with them to address the clinical needs of our city. So specifically around contact tracing, many of the community health centers and hospitals have really committed to providing access across the city so that residents can access care when needed, testing when needed. We have many of the community health centers as well are participating in contact tracing efforts and in communications with their patients. So we appreciate very much the work that they're doing there. And we have had ongoing relationships even prior to the pandemic, but reinvigorated communication with hospitals around how they are preparing for how they have been made it through the peak of our pandemic in April, and how they continue to prepare, setting up their incident command structure, and how we can be aware of what resources are available across the city in terms of clinical capacity. Unfortunately, we are seeing an increase in activity in terms of positive cases as well as hospital utilization. And so, you know, these increases we haven't seen since May. And so we are really trying to think about how we are doubling down and strengthening our response and what we can do moving forward. So this is ultimately we're going to talk about in the next few minutes to see what lessons we've learned and how we can utilize the effective strategies in the months coming forward so that we can keep the numbers low. Thank you again for coming.
Thanks, Dr. Lowe, and thanks, Rita. And so what we'd like to do is just walk you through a little bit of, as we see this increased activity, you know, where have we been and where are we continuing to go. So next slide. This is data that you all know well. You know, we've seen increased daily cases. These are some of the specifics. As of the October 24th, our daily moving average is 121.3 cases. Right now, again, that increase is high. Give you some sort of sense. It's much higher than one of our lowest points, where our average in the summer was about 28.6 cases, but still quite a bit lower than our peak in April, which is about 331 cases we were averaging around that time as well. Our current positive rate, 7.8% as of the 24th. Again, much lower than April, but obviously has climbed over the past several months and continues to climb. Next slide will show you that the metric we continue to monitor related to increased activity is in our Boston emergency departments. Activity in the hospitals include higher rates of patients in the ED. We're averaging about 40 people of an increase in average over the last month. And we see increased numbers of patients admitted and in the ICU over the past several weeks. Although all of those indicators are much, much lower than they were during the peak, they do show us that we see increased activity in our hospitals. And then the piece, obviously, that Rita had mentioned, overall, 33% of our cases are Latinx, 30% are African American, both of which are higher than the percentage of that overall population. And in the past month, about 40% of our cases have been in the Latinx community, while the Black African American rate has come down, thankfully. But again, we still see disproportionate impact over the past 6 months, and that continues across the community. So next slide, just to keep in mind, we've been really focused on being able to share some data with everyone so you can see sort of what we're seeing in terms of understanding where we're at. And so I'm not going to go over every slide. There's a bunch of data here, but I do want to share with you. This is the COVID-19 testing of Boston residents by race and ethnicity in kind of 2 different time periods, from March to June, middle of June, and then middle of June to October. And what you'll see is we've greatly been able to increase the number of folks getting tested. Every population has seen an increase of folks getting tested. More in the Black African American community, more in the Latinx community, obviously more in the white community as well. And we've continued to increase testing across the board. As a reminder, this is unique individuals getting tested. So we're continuing to make sure that more folks are getting tested than early on in the pandemic. Next slide, you're going to see our rates, the Boston COVID rates per 100,000 residents by race and ethnicity. And this gives you a sense of the cases that are here. Still, we've seen a disproportionate impact in the earliest part of the year in the Black African American community, 4,300 cases in those the first time period. And then that has greatly gone down, even though testing has increased, but that has gone down in the Black African American community. And I think the focus by the community, the focus by the health department, BPHC, and all of us trying to bring down those rates in the Black community, I think we've seen some progress on that. But again, in the Latinx Hispanic community, we've seen a much larger percentage continue to be high and climb across the board. And so we see the rates per 100,000 residents still be much higher in this second time period. Next slide is going to show you the rates per 100,000 residents by race and ethnicity. That's broken by age. In the earlier part up until June, you saw obviously you see the Black African American rates by age, highest at 65 plus per 100,000 residents, obviously still disproportionately Black and African American. And if you look at our June 15 to October 22nd time period, much more focused in the Latino community as well in terms of the age range of how this is broken down. Again, not, want to show you this data, but it continues to show us some disproportionate impact by population across the city. And again, where we saw much higher rates of 65 and over earlier on in terms of the cases, sort of has spread out quite a bit from June 15 to October 22nd. Next slide gives you a little bit of an indication ongoing of looking at the mortality rates per 100,000. The mortality rates in the African American community very high, although 234 deaths, more deaths in the white community, but by population, disproportionate for the Black African American community. And that has continued to be disproportionate even in the June 15th to October 22nd. So although the Latinx case rates have been much higher, the Latinx death rate has been much lower. That's a younger population in the Latino community testing positive in the past several months. But again, continuing to monitor this, but it shows you that the mortality and the impact in the Black community has been disproportionate in terms of who has unfortunately passed from COVID. Next slide will show you a little bit about race, ethnicity, and mortality in terms of the actual death numbers. Gives you a sense of those under 65. Obviously, most of the deaths have been over 65, but gives you a sense of where we're seeing that the deaths under 65, predominantly in the Black, Latino community. And then if you look at the deaths over 65, by pure numbers, the largest population has been white. But again, we still see that spread out a little bit more as you get 65 and older. But the under 65, much more heavily focused in the Black and Latinx community. Next slide. And we're going a little quick on the slide, the data here, but we want to make sure that people will have access to the information about where we're seeing. These are by neighborhoods. These are COVID rates per 100,000 residents by neighborhood. This is March to June. The next slide will be June to October. But it sort of shows you by neighborhood here. You see in the earlier time, the Black community in almost every neighborhood is the hardest hit community at this time. And so there was definitely a disproportionate, a little different in certain neighborhoods, but you see that with the orange bar across these neighborhoods, rates per 100,000 residents. And the next slide, you're going to see that shift somewhat to the purple, which is the Latinx Hispanic community. So we show you this because it's not just one neighborhood or just one area, but it has cut across all of our neighborhoods in many different ways. And we sort of are looking at this. I think this has been really centrally important to us to target initiatives and target outreach and target efforts within specific neighborhoods, which has been key for this work. Next slide is, so based on the data that we see there and based on what we've seen, two quick things before we jump into the enhanced response. There's no question that there has been some progress made. We've been able to contain COVID into the summer. We brought down positive rates. We brought down mortality together as a community. We've seen progress in the Black African American community in terms of the number of new infections. And however, still much work to be done with the increase in the Latino community. And also we've been very focused, as I know you will know, on the vulnerable populations, our older Bostonians and our long-term care facilities, as well as our folks who are unsheltered. So while we've learned a lot about what's worked, hospitals are more prepared than they were today. We have much more testing access than we did. We are now on the edge where we start to see an increase. And so as we're seeing this increase, we have an enhanced response to this increase that we're really focused on over the next 60 days. COVID's going to be with us much longer than 60 days, but we tackle this into what are we going to focus on over the next 60 days. So on the next slide, you're going to see us, and we're going to, I think, actually go to two slides. On the next slide, you're going to see us talk about some specific buckets. So sustain and expand testing availability across the city. We're not going to talk about too much of these next two slides because this is what we talk about every day. We're trying to make testing accessible with our health centers, our mobile testing. We're going to continue to do that. We are expanding health center mobile testing over the next week or so to include testing within our BHA housing developments and in specific neighborhoods where testing access needs to increase, including in Hyde Park and in Mattapan, as well as our mobile testing unit that continues to make testing accessible. It's also getting cold. Today's like no day, right? It's snowing today. So we know that we still need to get people tested even when it gets cold and the weather gets bad. So we're going to sustain and expand our testing, which is really important. On the next slide, though, you're going to see that usage is just as important to us as making it available. So we know that many of you, next slide, many of you covered yesterday the the testing pledge that was there. Can we go to the next slide? Yeah, so you're going to see that the increased testing usage is important, right? So you saw Get the Test Boston pledge that the mayor spoke about yesterday. That's an important pledge to make sure folks are taking advantage of it. We are exploring and have started to try to tie testing sites to already existing programs or services. Certain partnerships in the community are tying flu clinics to potential testing sites so that we can create greater access. We are also increasing the number of, or the method of outreach using different forms of social media, using different methods to try to connect with folks from individual level outreach in neighborhoods and communities, as well as ensuring that frontline essential workers continue to have low barrier access. Next week, we're meeting with some of the local unions to talk about ensuring that employees have access, frontline staff and essential workers, and how we can support that. For example, we're partnering with East Boston Neighborhood Health Center in the next week or so to make sure they can create access for airport workers who are living in East Boston in a facility close to them as well. So we want to create access, which is important, but we need to increase usage, which is also just as important to contain the spread. Next slide is going to show you that we are expanding contact tracing efforts and data usage. We're continuing to work with our contact tracing partners at the state to ensure folks are connected and we can trace that. We're monitoring lab receipt times, and you see this on here because as things get busier, we want to make sure that the time between when someone gets tested and when they get notification and then we get notification isn't longer than 72 hours. And so we're working, if that becomes an issue, we will continue to work with the state and our lab partners to address that and talk with the labs about that availability. It's very important that it not take as long as it has taken, sometimes when it's gotten busier in terms of usage. We are also going to start to create a bi-weekly report. Report might be a fancy word for saying update, but a bi-weekly update on case investigation information to indicate specific issues and or themes of how and where people are being exposed, which is a really important part that we're continuing to focus on. You have to test, but you also have to make sure that we're tracing and what are we learning from the tracing, which I think has been important. I'm going to pause here for a second. Dr. Lowe only has a couple minutes left, but I'm going to pause here. Dr. Lowe, I was just wondering at a high level, we're seeing things around our contact tracing that are important. I was wondering if you might be able to provide a bullet or two for our folks in the press about what are some of those scenarios that we're seeing in our contact tracing or case investigations of where people are getting exposed, just at a high level so people can understand that. Jen?
Yeah, no problem. So the stories that have been coming from our case investigations really indicate people, they are trying to adhere to the recommendations of staying within small groups. So they might have a lot of the cases that we see that potentially could be spreaders to others. They'll have small groups of people gatherings, 3 to 4 people, but then what will happen is they might have groups gatherings every day of the week. So 3 to 4 people on Monday, Tuesday, Wednesday, and Thursday and Friday generates 25 contacts. And that's similar to having one party with 25 people having one person having 25 contacts. So that repeated social activity, I mean, we're human and we want to have social activity, but those repeated exposures can exponentially increase the number of positive cases from one positive person. In workplace settings, our partners, our workplaces have been very consistent in terms of trying to adhere to the guidelines about social distancing and masking and whatnot. Some of the areas that need to be reinforced are around break room gatherings. Again, we are social people, and we have to eat, we have to take breaks. And so people going to the break room, removing their masks, maintaining 6 feet of distance, but eating without their mask on for an extended period of time. That seems to be another common area of where contacts can occur. So those are just some highlights that we've seen over the last couple months. And so we're going to continue to try and identify themes and behaviors so that we can share with you that information and the public. Thank you.
Thanks, Dr. Lowe. And just for everyone, I think that's important, right? I mean, I think so much of this is we wish there was just one reason, or there was just one thing that we could fix and solve and it would go away, but it isn't. There are some things that are happening in different situations where people are getting COVID. So Dr. Lowe, one of the reasons we added this on is we want to be able to share some of the case investigation information. We're digging into it, but we also want to be able to share it and start to really make sure people understand, even if it's not 70% of cases this way, but more so if you're an individual and you are gathering with people in your home and it's 4 or 5 people and it doesn't seem like it's a big deal to you, we want you to know that that is one of the reasons that people are getting COVID based on what we're finding out as we do this work. So I just wanted her to share that. Thank you, Dr. Lowe. Another piece on the next slide of our enhanced COVID response based on this uptick is isolation support. We need to ensure availability of isolation still exists. I know you all know this. We've done a tremendous amount of work for our unhoused population and lifted up a lot of isolation support for them. We are going to ensure that availability exists as we're continuing to test folks in the homeless community. We're raising community and healthcare provider awareness about our current isolation support we have available at a hotel in Everett that we're partnering with the state on, so that there's current access and availability. And we are also starting emergency planning efforts for potential larger isolation support that may be needed. So hear this now, we don't think we will need this, and we hope we won't need this, but we are starting the effort to plan for the need where we may need to have folks who have space to isolate somewhere outside of their home. So we're starting the planning efforts. We never actually put away those planning efforts, but we actually are picking up some of that work to make sure that if we need it, it's available. And last but not least in this area, home kits for families needing to isolate safely at home. We're going to offer distribution at health centers and through BPHC. Lots of folks get it and then go home, as Dr. Lowe said, and unfortunately give it to their family. And so we need to make sure people understand. We've done a lot of outreach, but now what we're going to do is try to create some home kits for distribution through health centers and other locations so people understand concretely, not just what they're being told, but some tools and resources that will help them. On the next slide is related to the hospitals, and what we think is an important piece is not only are we doing prevention, all that work, but if people get COVID, we have to really make sure in terms of isolation that we're also providing support needed to their hospitals. So we're staying closely connected to our hospitals to make sure that the support they may need about whether it's PPE supply, community messaging, if there ends up being a need for a field hospital, we are having those conversations with them. On Monday, I believe, the mayor and leaders from BPHC were talking with hospital CEOs to check in with them on where they're at. And we are going to be regularly convening the Boston hospitals to develop an action steps and strategies to address real-time capacity issues to help them prevent reductions in their services. You may remember for so often during the initial peak, we were telling people, don't go to the hospital, stay away from the hospital, because hospitals needed to take care of those with COVID. Now what we're doing in partnership with the state will be to convene the hospitals to make sure that they're prepared to address any capacity issues that may come up. This uptick is showing us there's more activity in the hospitals, and we need them to not, we need them to be supported so they're not having to reduce any services within the hospitals themselves. And then the last couple slides here that I want to show you that it's important beyond the isolation in the hospital. The next slide here is going to show you there's a couple different buckets, but increased targeted population and neighborhood outreach. We've been doing a lot of this work, but we're going to expand it. Expand our outreach to really focus on 39 and under in many buckets. We're continuing to see, based on current data, based on efforts around our cases and what we're seeing, that 39 and under continue to be the population that's testing higher in this latest uptick. So we're going to be looking to expand our use of public health prevention messages, social media, small businesses, text alerts, dare I say it, dating apps. We are going to go where younger people are at and continue to express and expand that messaging about the risks associated with what we're seeing. Also, in addition to that, we're going to continue to partner with our community-based organizations, but do additional investments related to the focus on Black, African American, and Latinx communities, with ongoing information to access testing, public health strategies, and in partnership with those organizations in key neighborhoods. One of the partnerships that we're working to get off the ground is a partnership with MIRA, the Mass Immigrant and Refugee Association, to identify immigrant healthcare workers to serve as ambassadors for some of the messaging out into the community as well. So we're going to be really focused on that piece on the outreach. Next slide, in addition to the increased targeted population and neighborhood outreach, the next slide is going to show you that enforcement continues, and you've heard some of this already, but I want to just give you a little bit more detail. The inspectional services in partnership with Boston Police, the Health Commission, Neighborhood Services, and Parks. We are responding to issues of informal gatherings in public spaces, parks, private homes that are really violating public health guidelines. We have started tracking problem areas or problem addresses, and we're working to prevent those activities from occurring, as well as we've started to fine homeowners for violating public health orders of ongoing gatherings, and to continue to do that, to be real specific about those issues that are in play. Even, for example, this weekend for Halloween, inspectional services will have inspectors out in the community in areas that we've had some concerns, and making sure that businesses and any informal gatherings that should not be happening, that we can call attention to them and make sure that anything that's coming into the BPD party line is being connected back to inspectional services so we can track, trace, and understand what's happening. We know people want to live and socialize and do those things, but it's incredibly important that we limit these public gatherings that have been creating some of the activity that's going outside of our public health orders. Hopefully the snow that I'm looking at outside today will keep people from being outside and in those gatherings, but unfortunately those gatherings can also happen in homes, which is a little trickier to do, but we've been trying to tighten that up. In addition, on enforcement work, the licensing board is working to raise awareness. We've already started doing calls with businesses in key neighborhoods to ensure that businesses are following sort of the guidelines that have been laid out. And we will issue fines if needed based on those violations to continue to restrict some of the issues that we may be seeing from our local businesses, who are all working so hard to stay open and survive, but who we need to make sure follow those restrictions. And then we're going to reaffirm the mask order to push for universal mask wearing in the city of Boston. And what we mean by this is working to just affirm the requirement in public buildings and in spaces, and work with businesses to reaffirm the requirements that many of them have, that people must wear a mask when they walk into a business, that employees have face coverings, and that they're actually wearing them over their mouth and their nose, and that those are available and accessible. We don't, and I think members of the press know this, the mayor doesn't believe that we can or should do an enforcement piece of mask wearing. We think there's a lot of equity issues about how a mask wearing gets enforced, and a lot of concerns of what that would look like. What it doesn't mean is that we can't continue to stress that everyone should wear a face covering when they're indoors and cannot socially distance themselves. And so we're going to continue, and we're going to reaffirm that with more messaging coming into the next couple weeks of what does that look like, and how do we continue to make sure people are wearing facial coverings. And then the next slide is related to restrictions on reopening. So these are recommendations and of things that we're considering in public health and health and human services. As you know, we're fully remote for BPS right now. The plan is to stay in that until we can see 2 weeks of sustained decrease in average number of cases. We haven't seen decreases in cases in quite some time, so we're still watching on that. And again, that's an important piece we're looking at. And these other pieces that are here, these are things that we're considering. We're considering a potential reduction of indoor gathering capacity back down to 10 people. We are considering potentially pausing indoor dining for a duration of time. And we're also considering the reduction of capacity of outdoor gatherings to 25 people, with fines for organizers of more than 25 people in terms of events or gatherings. You'll see that I continue to say we're considering these things because it's important right now when we see this uptick. We have to do all the prevention stuff that's in front of us, but we also have to consider how might we tighten restrictions on some of the reopening efforts, and how might we partner with the state to be able to do that. The mayor has been so committed that while we live with COVID, that means we also have to have businesses opening, and sort of the financial and economic lifeline that is our businesses and our restaurants and those entities, they need to survive. And so we need to do them both at the same time. But while we're seeing these increased in cases, we are definitely considering these potential tightening of restrictions because more indoor activity with more people is going to continue to spread COVID. And we want to make sure that we're looking at all these that are possible. So none of these are set in stone and none of these are ready to be implemented, but we are considering these types of restrictions on our reopening efforts while we try to get COVID more under control and have it be, as we continue to look at where we're at and focus on it. And last but not least, and then we're going to open this up for questions that people may have. Last slide is modifying data calculation and reporting. This is more about how do we make sure that we're digging into every piece of data that we have. We're looking to better track COVID activity and case rates, looking at how we use the total unique individuals tested each week to calculate citywide positive test rate. What we're trying to do is just better make sure that we are calculating and understanding the spread of COVID in the community. And so we're looking at how we're calculating our data. We have close to 50% of Bostonians have been tested, 50% of unique folks, which is great. But we need to make sure that more people are getting tested, not just for our first time, but people are getting tested regularly if needed based on their experience. So we want to double down on making sure we're tracking the COVID activity and case rates. We are going to start looking at the ability to report race, ethnicity, and age by neighborhood weekly. We're not there yet, but that is our plan over the next couple of weeks to be able to better understand who's being impacted. You saw some of the historical data in the earlier slides. Our goal is to be able to start to present that data to have a better handle of some of that information that's being shared in the community so folks can see sort of where we're at. And we're also working with hospitals to make sure we can expand hospital-based data that's being shared to highlight the efforts that are happening there and gauge any other issues we're seeing in the healthcare system. So, we'll stop the slides now, but the piece that I want to just make sure is clear for folks, and we can open this up, is that we've seen increased activity. You heard Rita and Dr. Lowe sort of share with you the, some of the progress we've made since we were in our peak in April, and some of the things that we've been able to sort of address and focus on in the equity lens we've taken to all this work, which has been important. But now we're in the beginning of November, and we're starting to see this uptick that we've seen now the last 6 weeks or so, and we are taking this enhanced response approach that's going to focus not only on all those prevention pieces we mentioned, but also on the making sure folks have the care that they need, but as well as where do we need to tighten restrictions, where do we need to ensure we're strengthening enforcement, and how do we make sure we continue to follow COVID data as closely as we can so we continue to monitor everything we're seeing across the community. So that's where we currently are. I'm going to stop there and open it up for any questions people may have. If you had a question for Dr. Lowe, she unfortunately did need to run to another presentation she's doing. We can follow up on that. But again, Rita is also here, and Rita and I are glad to take any questions people might have. So we'll stop there.
Hi, Chief. It's Sean Cotter at the Boston Herald. You mentioned that the city's thinking about pausing indoor dining and reducing gathering size. What goes into those considerations? What benchmarks are we seeing if we hit, or what else goes into those factors?
Yeah, I mean, what's going into those factors, Sean, is, and what we're looking at is, as we see increased cases, right? We've gone up, we're at 121 case average right now. That number was in the 30s about 7-8 weeks ago. And so what's going into it is we're looking at all of the metrics that we're monitoring, our daily number of cases, our positive test rate, what we're seeing in the hospital, and what we're seeing in terms of some of the issues that we're seeing across the board, as well as what we're learning from our contact tracing. Where are people getting COVID? Where are people being exposed to it? And as we do that, we're going to look at the restrictions that are out there and how we've reopened, and monitor them and consider everything that's possible to try to reduce the spread. But we have to do it in a balanced way. We've made no firm decisions, and the mayor hasn't yet made any of those firm decisions. But what we will do is consider the restrictions that are there and make sure that if we need to pull something back because we see cases continuing to increase, or we see them increasing in that area, we will pull back on those areas if necessary. So there's not just one number or one kind of metric. It's a combination of the increased activity that we're seeing that we want to make sure to stay on top of.
And how close are we to that?
So yeah, it's hard to say, to be honest with you, right? I mean, we've seen this increase, we've seen our rate increase, and are we here today? Are we here tomorrow? No. But we have data that comes out every single day, and as that data comes and more cases are coming, we're going to have to continue to monitor and make sure that we stay on top of it. We're not going to wait months and months and months until we see ongoing increase. What we're going to do, and the mayor's been has made tough decisions all throughout, has really been to look at the data, and if the data tells us that we need to pull back on something now, we will do that. It's part of why we even decided, and I know you all know this, when the state went to 10 people at a table about a month ago, we didn't. We stayed at 6 people per table in a restaurant because we didn't believe that was the right time for us to do that here in the city of Boston. So we're going to continue to monitor that and look for all signs and do what's needed to keep people safe.
Hi, this is Catherine Carlock from the Boston Business Journal. First, thank you for this overview. It's very helpful. Marty, I'm wondering if the consideration is to limit 10 people to indoor gatherings, would that also extend to offices and workplaces? And would it be a certain number of people per office, per floor, per building? How you would think about how that would shake out for commercial offices?
Yeah, it's a great question. And the 10-person restriction that had been put out initially by the state had been about gatherings. And there are separate restrictions based on workplaces and both essential businesses and then workplaces in general. For us, what we want to be able to do is, there are still, it is still recommended in many ways for people to work from home if they can. That is still something that we would recommend. We know that all you got to do is drive through the city during rush hour and know that a lot of people are commuting into work. So we know a lot of people are working. But right now, if we think about those 10 people restriction, that's really about gatherings and making sure that there is more tighter restrictions on the number of people that can gather in a place, whether it's through an event, whether it's through some sort of meeting, whether it's through some sort of people coming together indoors, as well as looking at what's happening outdoors. But from a workplace standpoint, we really want to work with folks. We know the business community needs to have folks coming into the office for a variety of reasons, and we want to be able to continue to support that. So that is, the 10% is really for us about one-time sort of events or gatherings or meetings, and that really what that has been about. But again, I would encourage folks, employers to think about that. If folks don't need to be coming into the workplace, we encourage you to think about the ability for folks to still work remotely. It's important. And the more we can do to sort of have less people interacting indoors, the better right now.
Hi, Marty. This is Craig Lamote from GBH Radio. Dr. Lowe addressed some of the information from contact tracing and what we know from outbreaks a little bit earlier, but I wanted to just ask sort of a follow-up. We got more information from the state this week than we've had in the past about some of the sources of clusters. And, there's been a lot of talk up till now about social gatherings and how young people were getting together and that was really the source of the problem. But the vast majority of clusters are coming from households on the data. I mean, it's 2,707 compared to 11 for social gatherings. And I just want to ask about that. I mean, it does raise the question. I mean, a cluster could be just, a couple people in a family, right? But the question is, where did that one person get it? The social spread of it, and how is it getting into those households? Could you just sort of address that, and also anything regarding, does it say anything about disparity in terms of how crowded some of these households may be in some communities?
Yeah, so Craig, that's a great question, and I think that's part of the challenge, right? I mean, I think part of the challenge is that both where do people get COVID and then do people bring it home? And sometimes the cases, and you saw that in the state data, but we see it as well. It's about, multi-generational households, for example, in communities where people are living with more than 2-3 different folks within their family, giving it to each other. So that's why you saw a little bit in our own a strategy about how to make sure people are prepared to be home with COVID and keep others safe in their household, because that's one area we need to sort of try to intervene in the spread. I think the second thing that we've also seen, though, and I think you heard Dr. Lowe talk about this, is not just the households getting family members being infected from each other, but also the really informal, casual, we're not going to call it a gathering, but I'm going to call it, Craig and 3 friends get together and watch a game. And these are people he knows well, and he's sure they're fine, and and they're doing the best they can, but one of them ends up getting COVID, and the rest of them end up potentially getting COVID, and then that brings it to their home. So part of it is also about these informal, I even hesitate to use the word gathering, because lots of times people don't see those as gatherings, but they are those informal, I got together with 3 people in my house. And that's also part of what we're starting to see from, especially when we look at the 39 and under, we've started to see that as part of it as well. But that's why so much of this enforcement plays one role, but so much of this is about folks' individual activity and people understanding the messaging that's out there about how to keep themselves safe and what they can best do to ensure that they're not spreading COVID to others, which is a difficult thing to do right now, especially as it gets cold, especially as we get to holidays, especially as we get to the time that people want to be interacting and, as Dr. Lowe said, be social. We really want to stress that there's a lot individuals can do. And I will say Bostonians have done so much of it. That's why we've made some really great progress, but we just need folks to double down on it and do the very best they can to not be around too many people too often. But the case investigations and the tracing that we're doing is showing us that there's not one reason, there's not super spreader, all these super spreader events that you see in other places, but there's a lot of small little scenarios that are happening that is really increasing the spread, especially in different neighborhoods and in different communities.
Hey, Chief, it's Danny McDonald from the Boston Globe. I'd like to ask you about house parties, if I could. I know the mayor the other week talked about cracking down on house parties. Yep. What's the status of that conversation? Is the city going to be fining people for Halloween parties?
Yeah, so good. Thanks for asking that, Danny. I mean, the situation with that right now, and something that we even hadn't done even a month ago, is, I think you probably know this, that if folks are concerned about a house party, they can call the BPD party line. And the BPD party line call will likely either get officers to come by to that party line, or potentially a community service officer is able to come by to that house to address it. What hadn't happened was that information then wasn't being conveyed in a kind of an aligned way to inspectional services. And the reason that's important is just like we do with problem properties. You know, I think you probably know this. We have a list of properties that there are some concerns with, that if you end up on this list, you can get fines, and it's a repeated number of times that you're on that list. So we're not putting these properties on that list, but what we are doing is making sure that inspectional services has the information. So if a house is getting called on multiple times and multiple issues around gatherings or parties, especially right now when we have a public health crisis in front of us, then inspectional services can not only visit that house, in partnership with the police department, but they also can contact the homeowner if it's not the owner, but it's renters. They can find the owner in that scenario as well. And that's part of why not only are we looking to have inspectors out for Halloween, but we're also looking to look at the problem property or the party houses that have come in through the party line for this weekend specifically, so that we can make sure to try to prevent some of those gatherings. But you and I both know well, prevention is one piece of it, right? How do we prevent those is something we're trying to do, but it's also the messaging. We're really trying to lean into that messaging, that a party, even a small one, around Halloween, there's no social distancing, and there maybe it's inside, it's gonna be cold or cool that night. That puts you at risk, and it puts anyone else around you at risk. So it's really, really important that we keep that in mind, and that we encourage folks to do that. So what we're trying to do is make sure that we can lean into the fact that we want to prevent these parties, but we also want people to think about what they're doing to prevent themselves from being in those situations. So enforcement is part of it. We're trying to tie it together a little bit better in partnership with BPD, Inspectional Services, and of course the Health Commission.
Just as a quick follow-up, you mentioned a field hospital. What's the likelihood for the need for a field hospital? Has there been any talk of reopening a field hospital at the convention center?
Yeah, so great question. I mean, we hope there's not a need for a field hospital. As you know, the work we did last time to lift that up was a tremendous amount of work in partnership with our hospital partners and the state and the city and through the mayor's leadership. So we are, again, we are convening the hospital leadership on Monday to learn more from them about the issues that they're encountering. We are convening them also to be planning around their services and their capacity and potential surge issues. And so we hope there's not a need, but we are not going to act as if there isn't. So we are going to start some initial conversations about what it might look like and what the needs might be to be prepared in case we get to that situation. Our hospital numbers, to be clear, just to give you some sort of comparison, I think I shared this yesterday. We had about 110 folks in Boston hospitals that are COVID positive. Right now, at our peak, we had about 1,500 in our hospitals. So we're nowhere near where we were during our peak. It doesn't mean that we don't want to be prepared to do it. But I will tell you, I think it'll be a larger challenge to create a field hospital now than it was in our peak because there was so much effort and everyone was working to make that happen. It'll probably be a larger challenge now, but we will definitely do the legwork if needed in partnership with the state and our hospitals if that becomes an issue.
Hi, this is Alexi with the Boston Herald. I just have a question about BPS and the threshold needed to get the kids back in school. I know last week when the switch to remote happened, it was stated that 5% could start having the high needs kids come back, but I noticed on your previous slide it said 2 weeks of decreased spread. So I'm just wondering which metric is it, and what other factors are going to be going into that?
Yeah, it's a great question. So the metric is a 5% positivity and for sustained 2 weeks of time. In order to get to the positivity, we have to see decrease in cases, right? So this is, in order to begin the conversation about in-person, we need to see 2 weeks of sustained cases to be able to start to have the conversation about what that can look like. Right now, all those metrics, either the positivity and the cases, are moving in the wrong direction. So we're nowhere near those places right now, but what we're trying to do is make sure we monitor the data across the board and that we're really digging into the information that's there. So sustained cases is what will get us to decreased positive test rate. And that is the key piece that we're looking at in terms of a metric. But again, that 5% over a sustained period of time is an important metric that we continue to monitor as we think about students coming back. Any
Thanks.
other
And
questions?
yeah, just to be cautious on time, that we have to jump up in 5 minutes. We probably have time for one more question before we head out.
If nobody else has one, you mentioned this is Sean Cotter with the Herald again. You mentioned that the city was looking at creating, or at least planning for, a larger isolation facility. Could you detail that at all?
Yes, good question, Sean. I think what we're doing is starting conversations. As you may remember, during the peak of COVID activity, we had set up multiple spaces and places for the homeless community to be able to isolate. But we also heard and had folks who were not homeless also need to go to the Boston Hope to be able to isolate who are COVID positive. So if we get to a place where either our hospitals or individuals need to isolate, we are also planning and having conversations in partnership with the state, in partnership with our community partners, to look at the ability to lift up an isolation space if needed. So again, we hope we won't need to be there. We actually didn't. That was sort of one and the same. Boston Hope did that for many folks at the peak. And so we're hoping we don't need to be there, but because of the increased activity of what we're seeing, we are going to start having some conversations about what that might look like and what the need might be if we get to that place. But again, we hope that we're nowhere near those numbers and we won't need it.
Well, and on that line, this is Catherine with the BBJ. There's the presentation said that there's current isolation support available at an Everett hotel. Is that Encore, or which hotel is that?
So we won't provide you the specific information about which hotel it is, but it's a partnership that we have in collaboration with the state that provides isolation support to folks who are COVID positive who cannot isolate at home. So it's a partnership that we work through, and we currently place folks there, but due to privacy concerns, we don't release the name of the hotel or where specifically it is.
Thank you everyone for joining, and thank you Marty and Rita. If anyone has any follow-up questions, feel free to reach out to me or to Caitlin at BPHC, and we'll be in touch. Thanks everyone.
Thank you.
Thank you.
Thank you.